You're welcome to today's antenatal class. I am Dr. Amadi. I'm a medical doctor, mother and child hospital. And today I'll be taking you all on antenatal class, the importance of antenatal class, because of antenatal care and antenatal investigation. So you're all welcome. I think we can just mute our mics, and then while we're going on with the class, if you have any questions, just raise your hand and I'll unmute you, or you can just put your question on the chat box and I'll take it when it's time for question and answers. That's fine. All right, so how are we all doing? How's pregnancy going? I know that like different people are at different stages of the pregnancy. Some of us are in the early phase, some are already in the middle stage, and some are in the late phase expecting labor to start anytime soon, or others that are booked for a cesarean section. So we're all at different levels. Pregnancy is different for everybody, and no two pregnancies are different, but I just want to encourage us all that we're doing good, we're doing great, okay, we're doing the Lord's work as well, okay, so more grace to your elbows. I mean, you're not alone in this, and definitely we're expecting good outcome. And when you hold your bundle of joy, so you're going to forget this whole difficult period.
Yes, sir.
All right, so we'll go right ahead into the class, and then we can chit chat later. So basically, I don't know how many of us have started antenatal care already, or antenatal start coming for their routine visits. Some may not have already, some have already, some don't even know what to expect. So at the end of this class, we expect that we should be able to understand what antenatal care is, the reasons why we encourage our clients, because pregnancy is not a disease. People are not patients. You are our clients. You come in to get checked and to have antenatal care and to get tested at different stages of pregnancy. So at the end of the day, we'll have this broad understanding, and we'll be able to also encourage other mothers to come in for their checks, to be regular with their checkup, and you can advise other people as well. So what basically is antenatal care? Now, antenatal care is the care which pregnant woman gets during pregnancy in order to achieve healthy pregnancy, a healthy delivery of a normal baby. So it entails the various types of care that hospital or health facility will give to a pregnant mother, so that the pregnancy is as close to normal as possible and the baby comes out healthy and fine. Now, good antenatal care enable mothers to eventually face labor in good health, okay, and in optimum condition. So why exactly do we advise mothers to go in or come in to get registered for antenatal care, to come regularly for antenatal checkups, and join antenatal classes like the one we're having now? Is basically want to educate mothers, young mothers, new mothers, or mothers that have had children before. It's basically to educate us all about what to expect when you're expecting. Because sometimes, especially the first timer, might be facing this with a lot of fears and challenges. And because you're at different stage of pregnancy, even with your own friends and peers, you may not really understand what you're going through. And sometimes when you tell people what you're going through, they will tell you, okay, I didn't experience that, I don't know, I have no advice for you. So basically to educate you so that you are armed, that you're ready, for what to expect when you're expecting. Our goal is to be able to promote the health of the mother, to protect your health, and to maintain good health for the mother during this period. Because in as much as we say pregnancy is normal, we also say pregnancy is not a disease, there are some complications of pregnancy, unfortunately. So there's some disease process that can come from pregnancy, in as much as pregnancy itself is not a disease. Okay, and majority of pregnancies are normal, babies come out fine. There are some pregnancies that unfortunately may get complicated. Now, some of those complications we'll talk further down are things like low blood level, what we call anemia, high blood pressure in pregnancy, what we call preeclampsia and pregnancy-induced hypertension, including diabetes in pregnancy. This is what we call gestational diabetes. Okay, and then there are other commoner ones like malaria in pregnancy and the likes. Now, antenatal care and antenatal, visits enables the doctors and the midwives to be able to detect high-risk cases. Now, these are the few cases that will not result in a normal pregnancy or normal delivery. And those high-risk cases are the reasons why we do this routine care. So we're able to single out those mothers who we feel we need more urgent checkups, further tests, or more proactive management during their labor, or an alternative to vaginal delivery, maybe cesarean section or assisted birth. It also helps us to be able to make proactive approaches to complications. So we're able to know that this pregnancy, may get complicated. So we need to put in some measures on time. It enables, antenatal visits enables the mothers to also relieve their anxiety and their dread and their fears during pregnancy. So it enables us to debunk all the myths and all the theories that mothers come with. So we're able to tell you this is not right, this is not true, so we're able to relieve your anxiety, answer your questions. It enables, the healthcare workers to reduce deaths from pregnancies, because there are actually, unfortunately, some pregnancies that, get that complicated, but we're able to reduce incidences of problems and major complications in pregnancy. We're able to teach mothers about childcare, newborn care, okay, because a lot of people, this is their first time, could be their second time, and they're not gotten the full grasp of what to do immediately after they deliver. And that's such a very tough period, because you just had a baby, you're yet to recover fully, and then the baby also needs like 100% of your attention. So we're able to teach you methods from experience and from other people's experiences that will help you cope, during this newborn period, immediately after you deliver your baby. And then after the antenatal care, there's what we call postnatal care. Usually 6 weeks for most women, and then it can be earlier if there's a need to do it earlier. At that point in time, we're able to also see the mother, see the baby. So antenatal care spans over till even after pregnancy, what we call postnatal care, which is usually 6 weeks after. And this is what we want to know, that all the changes you've had during pregnancy have at least returned to normal or near normal. Okay, changes like your weight, the size of your tummy, the bleeding that happens immediately after birth. So that clinic is basically to check that you do not develop a complication after birth, and all the changes that are normal, call them physiologic changes, have actually reversed or gone back to normal state. Now, how often are you supposed to have your antenatal clinics, antenatal visits? Usually, we say monthly till 28 weeks. Okay, so when we say monthly 28 weeks, that means you should have one visit every 4 weeks, which is why when you come for antenatal clinic, the next appointment will be in 4 weeks' time. So that continues till your 28 weeks, and this is actually the end of your second trimester. Then we'll start to see you 2 weekly till your 36 weeks. And at the end of 36 weeks means that you are actually already at term, means that the baby can be delivered anytime from 36 weeks and is a normal term baby, normal weight, healthy baby. So then we start seeing you every week, because labor will soon start, and start telling you about the signs of labor, and we start checking for the signs of labor. Okay, so but this is general rule for most women. However, if the pregnancy is what we call high risk, or there are some complications we picked out early on, we can make the visit earlier. So you might start seeing the doctors more frequently, like every 2 weeks or every 1 week, as opposed to once a month. So what I said, just a recap, we're going to be seeing you monthly till 28 weeks. Then we'll be seeing you 2 weekly till 36 weeks, and then weekly from 36 weeks till delivery. However, if there's a need to make you come more often, doctor will definitely let you know that we have to see a bit more often, maybe because there's already a complication or not. But if it's a normal pregnancy, this is how routinely we want you to be seen. Now, in antenatal care in general, there is one very important visit, which is the booking visit. And that's your first visit. We advise that that first visit, should be done as early as possible. In our environment, we say by your second miss period, or usually it's between 8 to 12 weeks, you need to come and see the gynae to book the pregnancy. This is the booking visit. Now, this visit should be done early because it is the best time to be able to pick out high-risk pregnancies that we want to see more. You want to see the mother more often. It's also the best time to be able to know how big is this baby, what's the age of the baby, how many babies are there. So it's the best time to do an early scan. It's the best time to date the pregnancy. It's the best time to see how the baby is actually growing, because that early phase is very important, in the development of a child. So we want to keep a close eye on the baby early on. So we advise that make that first visit very early, between 8 and 12 weeks. Okay. What's basically the aim of that first visit? The aim is to, as I said, pick out high risk. So what we're going to be doing is asking you about your health, taking a history of pregnancy, okay? We want to be able to get the correct age of the baby, because that will help us time the pregnancy. We have to be able to know when to expect this baby, so you can make plans and preparations, so that the hospital also can make plans and preparation. So at this first visit, you also give a lot of information about pregnancy. That's when your education starts, because early on we have to tell you that this is pregnancy. It's not a disease condition. However, it's a period that is very, 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 very dicey. Some people have some problems, especially in early pregnancy. They can start vomiting, can start losing weight. They might have aversion for food. So there are a number of things that women go through in early pregnancy. So we have to give you information early on what to do to prevent this. We have to be able to know how big this baby is and date the baby, so we know when to expect it. It's very important, so that the things we're supposed to do at every time in the pregnancy, we can know when we're going to do this. When are we going to do a next scan? When are we going to do a next urine test, the next blood test? So this is very important. The only way to know is to actually do an early scan. But then a lot of women would know when their last period was. So we can also date the pregnancy with the last period. But doing a scan early on will give you a very, very more correct age and information about the baby and how the baby is actually doing. Now, at that first visit, we're going to do what we call the baseline test. We're going to do a number of tests. We're going to take your blood, we're going to take your urine. In the urine, we'll be looking out for infections. We'll be looking out for signs of protein in the urine or infections in your urine, just like I said, and then other complications of pregnancy. They may also show signs in your urine. We also want to look out for glucose in your urine, protein in your urine. These are things that shouldn't be there, So those, I think that's why it's important that we do it early, so that if we're able to pick it out, we can, we can forestall any major complication and then put in measures to prevent it from progressing. Also, going to be checking your blood level, your PCV, going to checking your genotype. We're going to do some basic screening for infections such as HIV, hepatitis B and C, syphilis. Okay, so these are some of the tests we do in pregnancy. For some other women, they might do some other advanced screening tests. For instance, if the woman has had a lot of miscarriages in the past, so we might want to, check her blood and do some check for the partner as well. However, that first visit, I said, is very important. It should be done as early as possible, so that we can know, how the baby is growing. We can pick out high-risk pregnancies that are risky and get complicated, and do those basic tests to know what we're working with. So basically, when you call
that plastic chair, let me lift that.
Okay, so I don't know. Can we just help us mute our mic?
No, that one goes. That side will go worse.
Okay.
Can we mute let me mute that plastic chair?
Okay, can we just mute our mics for now until we get to the group discussion? Thank you very much. So basically, when you come in, as I said, for every visit, we're going to definitely do a urine test. A very simple test. You only need to pee on a stick. So we're going to give you a strip to pee on it, and then we'll read it. We said we're going to be checking for infections, protein, glucose, or any other thing that could be a pointer that there may be a complication. So every visit, you would need to do that, a urine test. For some pregnancies, we may want to check your blood level more frequently, but that can be done like once in every trimester if it's normal. But if it's low, we might be checking it often. Now, low blood level in pregnancy is a very common complication of pregnancy, or called anemia, okay? Because basically the baby takes a lot of what you already have and may leave you with just very little, which is why we give you some drugs to build your blood level during the pregnancy, okay? So we might need to check your blood level more often if we find out that it's low at any point in time. However, your blood group, the infection screening for HIV, hepatitis B and C, and syphilis, these are done at the beginning of the pregnancy. There may be no need to do that later, okay? And then we're going to do a special glucose test called glucose tolerance test to be able to rule out diabetes in pregnancy, or called gestational diabetes. So that will be done around your third trimester, which is anytime from 30 weeks, okay? Now, for every visit, you'll be asked basic questions about your health, about how the pregnancy is going, okay? You'll be asked questions. If you have any questions, please feel free to always ask during your antenatal visit. It is your right to get information and clarification about anything at all, no matter how, mundane it may sound. Just always ask questions. That's the reason why we come for those antenatal checks, because by what you say or what you tell us, they'll be able to predict what next or what answers to give. Because, as I said, majority of pregnancies have no problems, okay? They are not disease states. But then if you're experiencing anything abnormal, out of the ordinary, always ask questions. See, is this normal? I'm experiencing this. I noticed this, and get clarification. You're going to be examined at every visit. So your baby will be checked. You have what we call a head-to-toe exam on the line couch. The babies will be checked, okay? Your baby's heart will be listened to. Sometimes we may need to check your pelvis during the first visit or during some point in antenatal. So if it's your first time and it appears that maybe your pelvis may look small, or just to measure the diameter, there might be need for your gynecologist to do a vaginal examination or a pelvic examination to see the size of the pelvis, where the baby is going to come out from. So if there's any suspicion that it's small or it's your first time, that may be done, okay? Also, some visits, you might need to go further and do some other tests. You might need to screen for the baby for some conditions like Down syndrome. So further scans might be requested. Some further tests may be done depending on your complaints or what the doctor actually finds when they examine you. Okay, so basically, there's some vaccinations that you also get during your first visit. That booking visit, as I said, is very important. At that booking visit, you might get vaccinated for tetanus. Okay, it's usually given for first-time mothers, can be given once, and then it's repeated in 4 weeks. And then the third dose, you get that in 6 months. And then afterwards, you get one in every pregnancy. So if it's your second pregnancy or the third pregnancy, so don't be surprised if they give you only 1 dose. But your first pregnancy, definitely, you get about 2 to 3 doses, depending on when you come for booking. Now, aside tetanus, okay, there are a few other vaccines that can be given that may be safe, okay, like hepatitis and rabies, if indicated. However, majority of the other vaccinations that we give children, like the MMR, yellow fever, BCG, we don't give them in pregnancy. So if there's any need for you to get that, just consult with your gynecologist. So we should advise women that when they're pregnant, it's best to stay away from people who are really ill, okay, because pregnancy reduces your immunity to an instant, to a varying degree, which is why you may have frequent, infections like vaginal infections are common during pregnancy, especially the fungal ones, candida, okay, throat infections, upper respiratory tract infections, viral infections, malaria, because your immunity is actually reduced. The baby is taking a lot of nutrients from you, okay, which is why, as you said, we supplement pregnant women with blood capsules.
You get my husband. Put on top.
Okay, we supplement blood capsules.
I saw say don't enter under the chair.
Okay, can we just mute our mics? Those that are.
I think Rita Queen should mute her mic. Rita, is there no way you can mute her from your end? I think Rita should mute her mic, please.
I think you can mute her mic. Mute her mic.
I'm trying to figure out it's I'm using my phone. Everybody seems to be mute now. Okay, mute all. Yes. Okay. I just did that. Somebody raised their hand. Okay, thank you very much. I already did that. Okay, so I hope you can hear me. So we're talking about vaccinations in pregnancy. I said the vaccine that we routinely give is the tetanus toxoid. It's safe, it's also very important. I'll tell you why, because tetanus can actually affect babies, especially very early on, because they have what we call an umbilical cord or an umbilical stump. And this is where you're going to be cleaning regularly. Sometimes when the diaper gets full, it's possible for poo to also get there. This is why we recommend that you clean very often with spirits. I use, there's a gel which usually prescribed called chlorhexidine gel. So that's just to keep the cord really clean. Sometimes children also get ear piercings. Sometimes they get circumcision, So tetanus can be quite common, and the commonest route is actually through that cord. So we try to prevent this by giving the mother the vaccine. So it's actually to protect the baby early on in pregnancy. So it's important that you get your tetanus vaccine. Like I said, there are other vaccines that we give children that may not be necessarily important, can even be harmful to the baby in the tummy. So we do not recommend that you get BCG, MMR, rubella, yellow fever. I said there's an epidemic, or you can say, okay, you can do typhoid. But for most vaccines, we do not recommend that in pregnancy, as well as over-the-counter drugs. We always advise you that if you're sick or you have a problem, please see your doctor. A lot of drugs that are not safe in pregnancy. Majority of drugs are not safe in pregnancy, okay, except indicated. So don't take over-the-counter drugs. You have to come and see your gynecologist so we can give you something that is safe and compatible with pregnancy. Medications that you'll be giving during your antenatal care and all through your pregnancies, instead of blood capsules. Also give folic acid very early on. That also helps to build the blood, and specifically it helps the baby's brain growth. In the first 8 weeks, it's basically the head and the brain that is growing. So at that point in time, you want to supplement with folic acid at least 5 milligrams during that first trimester, so that the baby gets enough of the folic acid. After the first trimester, from your 13 weeks, so usually we divide the pregnancy into 3 trimesters. We have the first trimester, 13 weeks, second trimester, another 13 weeks, and then third trimester. So during your second trimester, you will need more than just folic acid. So you can add other, blood capsules like Ranferon, pregnant care. Okay, so but do not take over-the-counter drugs. Please don't self-prescribe in pregnancy. So during the visits, the routine thing after the history and the tests, and then probably the routine scan, basically ultrasound scan should be done early in pregnancy to pinpoint, where the baby is, to determine how old the baby or how many babies are there, and to be able to date and time the pregnancy correctly. Okay, but however, there are other indications for having routine scans if there are complications or we're suspecting maybe the weight of the baby is too big or too small, or baby is not growing so well. May do a scan a bit more often. However, besides the first scan, the most important scan is actually like the 18 to 22 week scan done in the second trimester. So this scan is basically to rule out any problem with the baby's development, because it's at that stage that the limbs are developing, the heart, the lungs. So we want to be able to know that this baby is developing properly. So that scan is very important. If there's a need to do a third trimester scan, we will do that, but usually at least 2 scans per pregnancy. During every visit, you encouraged and giving a lot of health education. You are free to ask questions. You'll be told about your diet. Okay, diet is very important in pregnancy, because what you cannot get from just your prenatal natal vitamins, you should be able to supplement that in your diet. Okay, so you should be able to eat enough protein, take enough carbs, take enough calcium, vitamins, vitamin C, folic acid. So eat a balanced, healthy diet. Do a lot of fruits and a lot of vegetables, okay? And definitely, you definitely gain weight pregnancy, because the baby is going to add like 2 to 4 kg. And then the water where the baby lives is also going to add some weight. So you're going to add some weight during pregnancy. That's normal. You might add up to 11 kg. Okay, it's absolutely normal to gain weight during pregnancy. After pregnancy, you can go back to your fit farm. But during pregnancy, please don't do fit farm, because the baby needs all the food and the baby needs the water, and you need to be healthy as well. Remember I said the baby takes a lot from you. You need to replenish as much as possible. So it's a time to feel free to eat as much as you can, because you're definitely going to gain weight, and it's also good for the baby that you're gaining weight. If you're not gaining weight, we're going to worry, because it means that you may not be eating right, the baby may not be growing well. Okay, so this is also a sign that pregnancy is not going well. You need to eat well, eat a balanced diet. You need to get enough rest, okay? Because during pregnancy, there's a tendency for your blood level to be slightly lower than when you were not pregnant. Okay, so you need to get enough rest. You may feel tired a bit more often if you exert yourself, but feel free to take a break even from work and get enough sleep and enough rest. You can do some light activity and exercise, okay, but keep it, simple. Talk to your gynae about it. Nothing stressful, nothing rigorous. No, we're not advising to go on the treadmill. Just do some stretches in the morning and light exercises to stretch out your muscles, okay? Then wear, clothes that are comfortable, okay, clothes that will allow your tummy. There's no need to put like a belly abortion belt or belly button. You need to tighten your tummy, or wear spans, things that will really, really tighten your tummy. So just keep it simple. Wear something comfortable, something that will give you enough air, that you can move around easily. So t-shirt, dresses, just wear something, comfortable enough for you to move around easily and not feel choked up. Because pregnancy will make you gain weight, as I said. So you may not be able to wear your usual clothes. You need to actually get maternity wear, especially from your second and third trimester. So you're more comfortable, helps you more flexible. It gives you that ease, especially when you're going around and all that. So basically, clothing in pregnancy is also very, very important that you keep it simple, and probably switch your wardrobe to a maternal line if you can. Okay. Then for sex during pregnancy, you may need some advice for sex during pregnancy, because there are some situations that we may tell you, especially very early on in pregnancy. The early phase, some women experience some spotting, some experience some bleeding. It might just be basic implantation bleed when the baby is trying to enter into the womb and stay securely. It may also be a sign of threatened miscarriage, which is an early complication in pregnancy. So at that stage in time, your doctor may advise you to abstain from sex, or just keep it simple, no backflips or funny styles. Okay, you want to be comfortable, you want to be safe, you also want the baby to be safe. So discuss with your gynae if you have questions about sex during pregnancy, or you can actually have sex during pregnancy, except where contraindicated. For smoking and alcohol, that is totally frowned on and discouraged. Please, if you smoke or cigarettes or drink alcohol, you have to abstain from this during pregnancy, because it can have major deleterious and detrimental effects on your baby's health. the baby's brain, the baby's heart, and your baby's organs. Women that smoke, it's very common for the babies for them to have spontaneous abortion and miscarriages. Baby will not grow well. And for women that drink alcohol, there's what called fetal alcohol syndrome. So the baby might just not grow well and be retarded, and you don't want that situation. So we totally frown against smoking and drinking of alcohol. Now, even social drinking, I mean, like going to a party on the weekend and taking a glass of red wine, please just abstain from all alcohol during pregnancy. You can resume your social life proper after you give birth. And for those that their partners also smoke, you may need to talk to your partner, because there's also exhaled nicotine and exhaled smoke. So you don't want to be too close to a partner who smokes. So you might need to probably just, make your own room or talk to your partner about it. So smoking is totally frowned against during pregnancy. It's very harmful to the baby. Drugs, as I said, over-the-counter drugs, taking of recreational drugs like weed, cannabis, totally a no-no for pregnancy. It can have major side effects on the baby, including if your partner uses any of these drugs, as well as over-the-counter medications. Please don't do over-the-counter medications. Always seek for advice from a health professional. Okay, then there are other things you might experience in your body during pregnancy. Some people experience skin changes. Some people may experience problems with their breasts. Okay, their breasts may start getting sore. They may have breakouts around their body. So just basic hygiene. Always take your bath regularly. Clean your breasts regularly, but avoid overpressing the breast, because that can stimulate oxytocin hormones right towards the end of pregnancy. But just make sure that you maintain a very high level of hygiene. It's very, very important, because if you have an infection, you can't give it to your child, okay? Especially around the private area. So you need to make sure that place is kept clean, is hygienic. Yeah, as I said, there are some common infections that, not your fault, commonly happen in pregnancy, like vaginitis from Candida. This is like a fungal infection. So anytime you notice, you're having an irregular vaginal discharge, smelly, whitish, or more than what you previously experienced, just come to the hospital. We may do a test of that discharge and then give you treatment for it, but do not take over-the-counter drugs. Okay, if you need to travel or go for a trip when you're pregnant, you also need to see your doctor, because we have to be sure that you are fit to make that trip. Most airlines will even ask you for a fit to fly. So if you need to travel, still see your gynecologist, and then they'll discuss that with you. All right. So I want to talk to us about the warning signs that when you notice this during your pregnancy, you want to come to the hospital immediately. Now, if you generally feel unwell, okay, I just want to advise, if you feel unwell at any point in time, just come to the hospital. If it's not yet time for your routine antenatal, still come and talk to your doctor about how you're feeling. So it might be a sign of, an impending illness. So if you feel unusually unwell, please come to the hospital. However, there are some signs that are warning signs. Once you notice abdominal pain during pregnancy, that's out of ordinary. Early pregnancy, there may be some cramping, but if you notice any abdominal pain, please come to the hospital. If you notice any bleeding during your pregnancy, that's a warning sign, be a sign of something dangerous. Please come to the hospital immediately. If you notice you have headaches, blurry vision, feel dizzy, please come to the hospital immediately. If you notice any change in your urination, either pain during urinating, or you notice blood in your urine, or you notice that your urine quantity has reduced, please come to the hospital. If you notice that your legs getting to swell, or called pedal edema, or although, as I said, pregnancy, there's some changes, you gain some weight, your legs may swell a bit actually during pregnancy, but that one is usually more common when you sit for long. Okay, so if you sit for long hours, it's not uncommon that your legs will slightly swollen, and then when you sit normal or raise your legs, it goes back. However, if you notice severe swelling in your legs, or you notice swelling around your face, please come to the hospital. As I said, if you notice any vaginal discharge, foul smelling, whitish, abnormal color, blood in the discharge, anything abnormal around there, please come to the hospital because vagina is very close to your womb. If you have an infection there, there's a very high chance that it can spread to the baby. And you do not want that to happen. Because if the infection spreads to the baby will be uncomfortable in the womb and will want to come earlier than expected. And it can lead to a preterm labor. So infections are very common cause of preterm contractions. If you have any vaginal discharge or any sign of any infection, please come to the hospital. If you notice that your baby is not moving well, that's not a good sign. Please rush to the hospital. If you also notice that your baby is moving more than normal, it could also be a sign that baby is uncomfortable in the womb. Please come to the hospital, okay? And these are some of the common warning signs that you need to know about. And then if you start experiencing signs of labor pains, okay, lower abdominal pain, cramping that moves to the back, or you see water, or you see blood, or what we call a show, which is like mucus mixed with blood, these are the signs of labor, okay? Usually the pain is of increasing intensity. So labor pains keep increasing and keep increasing. There, however, is some form of pain that women experience close to term, where they just have like cramping. It's not painful, it's just contraction, but it's not painful, it doesn't increase and just comes and goes. That's not labor pain, it's Braxton Hicks. However, if you're already close to your term or close to your antenatal, please just still come to the hospital and get checked. So your doctor can tell you, oh, this is not yet labor. It's all called Braxton Hicks, and they're like preparatory contractions. Your tummy and everything is contracting and preparing for the D-Day. However, if you notice any sign of labor, increasing abdominal pain, okay, passage of show, which is mucus mixed with blood, passage of water, which is liquor, or bleeding from your vagina, please come to the hospital. And those are the warning signs, some of the warning signs. There are others that your doctor may be able to pick when you come in. Maybe if you do a urine test and you see protein in your urine and it's much, maybe it's like 2 pluses, or you come to for your routine antenatal and we'll check your blood pressure, your pulse rate, your breathing rate, and we'll notice anything abnormal, then those are warning signs and we'll be able to tell you that something is not right and you probably will need to stay in the hospital to get treated. So every antenatal visit, aside the fact that your doctor is going to check you, check the baby, you also need to check your vitals, very important, your blood pressure, your blood sugar, as a urine test, okay? You need to monitor your blood pressure in pregnancy because one of the complications of pregnancy is preeclampsia or pregnancy-induced hypertension. So pregnancy can cause high blood pressure, even if you do not previously have it, which is why it's very important that you come to the hospital, because if you're at home, you cannot check your blood pressure yourself. You are not going to be able to check your urine test. So do not feel that those basic things that we do are not important. They are very important, and they are the reason we ask you to come to the hospital, because we want to monitor your blood pressure, we want to monitor your blood level, we want to monitor your blood sugar, we want to do a urine test, we want to be able to check how the baby is growing from your previous visit to your last visit. We want to check your tummy, see that there's been an increase in your tummy size. Okay, so I know a lot of people, especially mothers that have had multiple children, okay, they just feel like there's no need to come. What are they really doing for me? When I come, just sit down and don't really say anything much because I don't have much questions. The guy doesn't have much to say. But forget that there are a lot of things that we do even before you get to the doctor. The fact that you are weighed is important. So those are some of the things that the doctor looks at a snapshot. They're able to tell if there's a problem or not. As I said, majority of pregnancies are normal. There'll be no issue. The baby grow well. Mothers do fine. There are no complications. However, there are one or two cases, couple of cases that we have to pinpoint early. And the only way we can do that is if you come to the antenatal clinic and come for antenatal class like this and have your routine antenatal test. You know, so it's really, really important. Do not say that you're an old timer or it's not important. It's just talk. Those basic things that you may overlook, we don't overlook them. We always look at them: the blood pressure, blood sugar, the weight, you know, blood pressure, the urine test. There are a lot of parameters we look at when we do a urine test and want to be able to see, want to be able to compare with your previous visit, and want to have the record for your next visit. It's very important that you come for your antenatal classes and you come for your antenatal clinics as well. And people are raising up their hands. Let me just check. Okay, so we're almost rounding up. Common signs in pregnancy, normal pregnancy signs. Early on, you might have nausea, you might vomit a bit. These are normal. They are due to the pregnancy hormones, and they're actually quite normal. But if they're out of the ordinary, if they're excessive, and if they're affecting your health and the baby's health, that's no longer normal. So if you're vomiting like 10, 20 times in the house, please don't think it's normal. Okay, come to the hospital. But if you vomit once, maybe after brushing or after some food or some abnormal smells, or twice or 2 times, basically that's overlooked, because a lot of women will have that. If they're spitting up a lot, it's also quite normal because of the high pregnancy hormones. There are other things like some backache, body aches. Those are quite common in pregnancy. Basically because of the weight of the baby, sometimes because your calcium may be low, which is why we supplement your calcium, during the pregnancy. But if you notice any abnormal backache, especially the type that radiates from the downwards to the back, you need to come to the hospital. It might be a sign of labor and early or preterm labor. Sometimes women notice that the veins in their leg become more prominent. They might notice hemorrhoids, what people commonly call the pile. Okay, so they might notice some protrusion around their anal region with some blood, in their stool. It happens because of the pressure of the baby. Okay, so there might also be an increased vaginal discharge, maybe a watery, clear discharge. That could be normal, but as I said, if it's profuse, if it's foul smelling, please come to the hospital. Reflux is very, very common in pregnancy, especially during the 3rd trimester. So you might have a lot of heartburn. Okay, so that's a common, common sign or symptom of pregnancy. Constipation is also common in pregnancies. Now, this may not need any treatment. You might just advise you on diet, diet improvement, eat more, balanced diet, a lot of vegetables, drink a lot of water. Okay, but if you experience any of these symptoms and it's really uncomfortable, please discuss with your gynae about it. Now, antenatal care, as I said, the first, just a recap, the first 28 weeks, you're going to be seeing once a month, and then you have your routine blood pressure check, urine check, be checking for the baby, whether you're still feeling the baby move at some point in time. We're measuring the baby's height. We'll do a targeted ultrasound scan once you're 20 weeks. So we're going to give you a follow-up appointment, like you're going to be 18 to 20 weeks in between. So you have to come for that scan. It's very important. It's called an anomaly scan. Okay. What's crucial is we're able to pinpoint or pick out complications like blood pressure in pregnancy, preeclampsia, okay, high blood pressure, and blood protein in your urine. That equals preeclampsia. Is a major complication of pregnancy. But we're also able to pick out things like diabetes in pregnancy, low blood level like anemia, and the baby is not growing well, baby is not doing well. Okay, so you're going to have your routine checks, and we're going to also carry you along during the pregnancy if you notice anything out of the ordinary. All right, so sometimes some women have some medical conditions in pregnancy. They already had it in the background. Maybe they have high blood pressure, they have a heart condition, or some other things they're going through, like epilepsy. Some people have other conditions, or they even previously had low blood level before the pregnancy. We usually advise this kind of women to have what we call preconception care. So once they're planning to get pregnant, you need to see your gynecologist, discuss about this condition, how it affects your health, how it's going to affect your baby. If you have a thyroid disease, you have high blood pressure, you have diabetes, you have epilepsy, you have anemia, or you're on any drugs which you need to take regularly, you need to be sure that it's safe to take this drug or to have this condition and be treating it while you're trying to conceive. Okay, so that when you conceive, if you need to stop that drug just before you conceive, or there need to be adjustment to the doses, you need to please talk to your gynae about that. Okay, all right. So general advice always take your medication, your folic acid, eat a healthy diet, okay? If you do smoke or you have anybody around that smoke, please, please abstain from smoking and stay away from people that smoke, all right? Come for your routine antenatal care. It's very important. First time, third time, fourth time, or fifth or 10th time more. Please come for your routine antenatal care. We'd love to see you. We want to see how the baby is going. Ask any questions you want to ask. Feel free to always ask your gynecologist any question. No matter how, simple it sounds or stupid it sounds, please always ask questions, okay? All right, so that will bring us to the end of today's class. And some might have questions and we can, have a good discussion. Since some already have been raising their hands, so let's allow them. Okay, so Galaxy A40. Okay, please, can you just put, can you just put your questions in the chat box and I'll take them as they come in. I already have a question. All right, so good morning. I'm a first-time mom. I'm in week 39. I'm feeling some pain in my lower abdomen since yesterday. It comes and goes, not painful. Is it Braxton Hicks? Do I need to go to the hospital? All right, so you're having some pain. It comes and goes. It could be a sign of early labor. Okay, for Braxton Hicks, it's usually not painful. It's just like a strong contraction, usually not painful. But you're already post-term, okay? So your baby's already fully developed. I'd like to know when your last antenatal was and if you've been checked by the gynae this week. If you already been checked, then I would say you should observe her today. If the pain starts increasing, if you notice that pain is increasing, or you see any other sign of labor, like passage of water, mucus, and blood, or a show, it means your cervix is still opening and they need to see the gynae. I'm sure by now they may have tried to quicken the labor, maybe doing a cervical sweep. But if they've not already done that, then you may need to come to the hospital to have that done. So it depends on how long ago you saw the gynae. If you just saw the gynae a few days ago, you can observe and see if pain increase. If it does increase, please come to the hospital. But if it's been like almost a week or a couple of days, please just come and get yourself checked. It's safer to say that. All right, so any other questions, please put it in the chat box.
Hi, good morning.
Okay, it's not that they rather switch their mic. Okay.
Hi,
Yes, I can hear you.
Yes, I'm Halima. I won't be able to type because I'm on the road. Okay, so I just have a question. So I'm about 8 weeks and I've been throwing up a lot. But my issue now is I throw up whenever I take water. So now I don't take as much water as I need to. And I don't know if that is a good sign or there's something I can do to help with the vomiting so I can take as much as I want to.
Okay, so how many times do you throw up in a day? Is it just only water that makes you throw up? Okay, so basically, as I said, nausea, vomiting, food aversions, even aversion to water are quite common. Okay, it's not good for you not to be taking enough. The advice I'll give you is to probably just, if you can, sweeten your water a bit, maybe add a bit of ribena or juice. Okay, some people even take ORS. So anything just to sweeten your water, you need a lot of liquids. So you can just change the taste. If plain water is making you to be nauseous or vomit, please feel free to sweeten the water and take a lot of juice as well. However, if you notice that you start vomiting a lot or you start getting weak, please come to the hospital. You might need to be rehydrated or you might need to be given drugs for the nausea. But it's quite common to have some nausea, some vomiting early on in pregnancy. Just sweeten your water and see if that helps you. Okay, so next question.
Hi, good morning. Hi, good morning.
Okay, good morning.
Oh, please, I'm a first-time mom and I'm 18 weeks and six days. Last week, Friday, last week, Saturday, yeah, I noticed that usually when I pee, I wipe, I use toilet tissue to wipe, toilet bowl to wipe, and I noticed that when I wiped, I saw a little trace of blood in it. And what I noticed then was that a day before, which was on a Friday, I went to work. I had a lot of activities that day, and then the next day too, I didn't have enough rest. The next day too, on Saturday, so I guess it was Saturday evening that I noticed that. So I didn't speak to anybody. I didn't speak to anybody, but but I kept on trying to I monitored it to see from last week till now if I would see any other blood discharge or any stain in my panties or in anything, but I didn't notice any of that. So but you mentioned that if you see any traces of blood, it was a very light blood. So so I said, let me ask that, do I still need to see a doctor now that I didn't see anything, or in like, what do I do from here? Yes.
All right, so any bleeding or any blood, it could be a sign of something, worrisome. I'll definitely advise to come and see your gynae so you can get checked. It's safer to get checked, and then baby's fine, the placenta is fine, and there's no cause for alarm than to just assume. Okay, so I will be a bit worried. I will advise to come and see your gynae. I don't know when last you had a scan. You probably need to have a scan so we can look at where the baby's placenta is. Be sure where the bleeding is coming from, because the bleeding may be coming from higher up. It may also be coming from the vagina area. It may be coming from the cervix area. So you need to still, come in and have your gynae take a look at you. All right. So next person. Some people already wrote out their questions. I need to take that. All right, so let me just take the questions in the chat box. If we still have time, then we can do the question and answer session. All right, so I'm a first-time mom, 33 weeks. I had a pain in my tummy 2 nights ago, got me scared, it was painful. It stopped, and since then I did not feel anything again. Could it be a false labor? The food I ate in bed? It could be a false labor. It could be the food you ate before you went to bed. However, if you notice this pain comes on again and is more serious and more frequent, please come to the hospital. Okay, it could be a sign of Braxton Hicks as well, could be false labor. But observe, and then if you notice it come back again or getting more frequent, please come to the hospital immediately. Now, what's the cause of upper abdominal pain radiating to the back? In pregnancy, it depends really. Could be a sign of reflux. So hyperacidity and reflux are very common in pregnancy, basically because the baby's head pushes up the tummy. Okay, the baby's head pushes up the tummy, and that pushes up the food content and acid content. Because the stomach is very close to your back, sometimes the acidity might reflect backwards or radiate backwards. So it may be a sign of ulcer in pregnancy. It may be a sign of hyperacidity or reflux. You might need to come to the hospital. The medications we can give you to help with the pain if it's too much. Okay? In 37 weeks, I'm first-time mom. I feel tightening sometimes. Could that be a sign of labor? Can pineapple juice induce labor? All right, so I do not think pineapple can induce labor. These are all myths. Okay? They've not been verified. They're just myths and hypotheses that people think pineapple. Some people think alcohol and different weird things can induce labor, and pepper, and those things are not shown from our own studies and research. Labor starts when labor is about to start. What makes labor start is when the baby is fully grown and mature at term, and when the baby's head hits the cervix starts to open up. That leads to a positive feedback that causes contractions to start, and then the process of labor starts. However, there are some occurrences of false labor. This can present as tightening and cramping and contraction. It might be very light pain, but usually it's intermittent, so it just comes and goes, it's not sustained. Okay, for labor, it's a sustained pain, sustained low abdominal pain, moves to the back, and then other signs like passage of water, passage of blood mixed with mucus, Okay, so these are some of the signs of full labor. So it may be a false labor. Good morning, doc. Have done my blood test during my booking and haven't been coming for my monthly checkups. My gynecologist says everything is fine. Is there anything to worry about? Because he said we should always do blood tests. Have only done blood tests during my booking and haven't been coming. Okay, yes, as I said, the blood test, if it's very normal and all the screening are negative, there is no need to repeat the screening test. Okay, but if your blood level was low at any point in time, then we may need to do it more often. However, once per trimester is fine. So those blood tests are booking. If they are very normal, you do not need to repeat it at every test. As the pregnancy progresses, once in your second trimester, and definitely once when you're close to labor, we will recheck your blood level and probably recheck some of all those tests if needed. But the only thing that will be done at every visit is that urine test. So that's the test that will definitely be done on your monthly checkup. Other things we'll do is to check your blood pressure, check your blood sugar, check your pulse, and the likes. Okay, so it's not compulsory we do a blood test every checkup, but a urine test, yes. All right, next question is, please, is it possible to request to be induced in week 36 and 37? I am tired. Okay, well, I can't even imagine what you're going through now. I know it's really, really a lot, especially when you're really, really close, like you cannot even wait for the end to come. For you to request to be induced at 36 weeks, I will not say it's advisable. Okay, one, you haven't really hit the criteria for induction yet. The main criteria why we want to induce pregnancy is if we feel that if we don't end the pregnancy, it's not the best condition for the baby. Okay, not just because we're tired, because we're looking at how that the baby is safe and the mother is safe. So we do not want to do it too early, because if you do it too early, the baby may not be ready to come out to the world and may need to be in an incubator. Secondly, induction does fail. So we can induce and induce and induce, and labor does not just progress, which will mean that we need to urgently do a surgery, cesarean section, okay, which would have been otherwise prevented if we did induce so early. So it's not advisable. Gynae will not even advise you to do that. But then if you hit 40 weeks, 41 weeks, 40 weeks, 41 weeks, then there is a strong indication for induction. And we have weighed the risk and we've weighed the benefits, and we know that the risks are minor, the benefits are major, very beneficial to the mother and the baby, because the pregnancy has hit its termination time. So pregnancy has to end because the baby will not have enough food, enough water after 41 weeks. So that is the major indication. However, if you are really, really tired, or you feel you may not want to go through labor, can discuss with the gynecologist about the option of having an elective cesarean section. Okay. All right, next question. Does mother and child allow one's partner into the labor room? Yes, we do allow the partners into the labor room. Okay. We can allow them into the first, stage room. By the second stage, we may want, of course, it depends on the partner. Some partners don't really want to stay, and sometimes they may actually distract, the midwives and doctors when they're working. But fine, we do allow partners into the labor room. It's still by choice, okay? Choice of both the partner. If the partner is able to stay and give the much needed moral support. We've seen some partners who fainted. We've seen some who actually excused themselves at some point, or who were even crying, or more emotional and more dramatic than the mother. So it really depends, but we definitely allow your partner to be there to give you the moral support, of course. Good morning, ma'am. I'm a first-time mom. I just turned 17 weeks, although I just registered yesterday. And my scan showed that I'm now in my second trimester. I want to know if it's okay to do second trimester, folic acid in the second trimester, since you mentioned it's okay for the growth of the baby. I wasn't giving folic acid yesterday, just Raphael and calcium. Thanks. Yes, as I said, in the early trimester, the first 8 weeks, the baby only needs folic acid. If you give any other thing, it's fine. Okay? Because when you're giving our vitamins, remember that you can get this from food. You're healthy, the PCV is fine. You may not need calcium, you may not need all the other vitamins, because your food actually gives you a lot of good vitamins as well. But if you're past your first trimester, once you're past 8 weeks, actually, okay, you don't need to be on only folic acid. You need to give you other drugs that will have, other medications that will have calcium, that will have other vitamins that the baby would need, your big complexes, flavin. Okay, so we need all that. We need your vitamin D, your vitamin E, vitamin C. So Ranferon actually has folic acid, okay? It has folic acid, it has other vitamins your baby needs. So after that, you do not need to be on only folic acid. You may not necessarily need to combine folic acid to Ranferon. Ranferon, pregnant care, Vitabiotics, and some other, pregnancy vitamins, they have everything you need. It's only that early phase that you really need at least 5. Since you're past 17 weeks, what you need is exactly what you were given, okay? Anti-malaria drug, yes, we'll give it in pregnancy. Thanks for bringing that up. Aside your tetanus, there are some drugs and your routine drugs. We'll usually give anti-malaria drug. It's called intermittent preventive treatment of malaria. But malaria is very common in pregnancy. So we usually give it when you start to feel the baby move, and then we'll repeat it like after a month. You might be able to get 3 or more doses during your pregnancy. But if you have malaria, we go ahead and treat for malaria. I do not know if we have any other questions. We're gradually coming to the end of our class. Let me see if there are any other questions. All right. Okay, that's the end of questions. We're coming to an end. I want to thank you all for coming. Okay, somebody posted another question. What is an elective section? How early can that be done? An elective means by choice is done once the baby is complete term. So at 37 weeks, you can have that done. I don't have appetite. What can I take? Okay, you should take your normal vitamins. Okay, the Ranferon is good enough. However, if you find that you have malaria, you may need to come to the hospital and have some tests done. But your routine vitamins is fine. It has your B complexity, it has everything you need. That's also safe in pregnancy. Are there any other questions? You progress well. Let's ask. Your story. All right. Final call for questions. You can just add general. Okay, you use pregnant care, but still no appetite. All right. Okay, I don't have the appetite. All right. So basically, as I said, pregnancy comes with food aversions, especially in the early first to second trimester. As I said, it could be a sign that you may have something else, in malaria. Those existing malaria will also reduce your appetite. So you need to come to the hospital and get tested and see your gynae. If he wants to add something else, add on for you, he probably would. Okay, but your pregnancy vitamins are actually enough. Having headaches for 2 days, please come to the hospital. Okay, you may need to have some tests done. You need to check your blood level, screen for malaria infections, check your blood pressure, check your urine as well. So come to the hospital. If you don't feel well, as I said, do not take any drug at home. You need to come and get checked. All right, so it was really a pleasure of mine. Take home notes: antenatal care, antenatal class, antenatal clinic, antenatal blood tests. These are so important in every phase of your pregnancy, any stage of the pregnancy, and in any number of the pregnancy, whether it's your first, your second, or your 10th. Please feel free to come in, ask questions. If you do not feel well, please come to the hospital. Remember the warning signs. Talked about bleeding, abdominal pain. We talked about headaches. Okay, so please, if you don't feel well, feel free to come to the hospital. Now, till we see again, it was a pleasure doing this. I wish you all the best. Safe delivery. See you all soon. Thank you very much. Bye-bye. Bye, everybody.
Bye. Thank you, doctor. Goodbye.
Bye. Thank you, doctor.